Why
No,
not?
you don't even look at my paper.
You talk to me. I talked to you about it yesterday. Is it okay?
You're not my mistake. Okay, I scored
I'm
it.
busy.
I scored you.
Okay, so we talk to you.
You're not like this. This is not fair.
What's up? Nothing. What are you doing? Nothing. You have a laptop in front of you and you have your highest scoring paper in the whole class. So we just throw this away. God, had it. Okay, that's something new for me. So what's up? Really, for real. Tell me.
Okay. You know my mom.
Yeah, what's up with her?
She's been ignoring me.
What makes you say that?
She doesn't pay any attention to me. You know, this morning I showed her the paper and I scored the highest mark, and then she said, whatever, and then she just left. That's it.
That's it.
That's it.
Student parents, I they tell you. They don't care about us.
No, I think they don't care about us.
If she cared, maybe she would have said, "Oh, congratulations, honey." But she didn't, right?
She didn't.
I have something that will make you happy. You see this particular guy over here?
Mm-hmm.
He has an interest on you.
For this guy?
Yeah, he has an interest on you. He has been asking me a lot of about you.
This guy, I mean.
Yeah. Yeah, he's cute. See, I told you, you guys would make a really cute couple.
Okay, why not?
Yeah, okay. Alright, then.
Hello, V. What's up? How's Adia? Have you told about me? Really? This could be fun. Okay, I text her now. Woohoo! Okay, ready.
You wanna make a point, but you keep preaching. Argue all day, make love all night. Being sweet, oh, I really wanna know.
Hello? Yeah, V. Hey, what are you doing? Yeah, I think right, I have a problem. Yeah, I haven't had my menstrual for 3 months. Yeah, it's been 3 months. What? What? Pregnancy test? What? Oh, but how? Hey, don't hang up first. Yeah. Why? You need to go? No, wait.
What?
You heard me, I think I'm pregnant.
Are you sure?
No, of
Are you
course
sure
I'm
it's mine?
I-
Are you sure it's mine?
What? Of course it's yours.
I don't know. Just about it. Whether you settle it by yourself.
What do you mean
Don't
about
call
it?
me again.
What? Where are you going? Is re-energized, and thank you to Dr. Maslino for useful input just now. Okay, now we shall move on to the third agenda for today, which is the dialogue session of WHO Assembly, and I'll pass it over to Tan, to the moderator just now, to handle this session.
Alright, thank you and welcome back. Alright, I have the 6 representatives here, so we are going to discuss on a few issues that we have already shortlisted from the presentation just now. First of all, we are going to talk about road injury, and after that we're going into underweight, sexual reproductive health, and lastly a unique issue which is the female genital mutilation. Right? Okay, this is just to tell you, to address you again, the objective of this session, to discuss and share experiences of adolescent health program or intervention. Okay, so they will mainly talk about challenges in handling the issue as well as the intervention. Okay, next. Alright, so first of all, we'll start with the first session, first dialogue on the road injury. Okay, yeah, this is the reason why we choose this topic to be discussed, because it is one of the most common causes of death among the adolescents by sex in the whole world, right? Okay, so I will first of all invite Dr. Fernando Torres from America, okay, to tell us what are the challenges, in handling this issue in the region.
Thank you, Mr. Chairman. Indeed, this issue is worth discussing because why? Because it is something preventable. Something can be done. We all can do it, and it can be do it globally. Alright, preventive injuries can be especially challenging for adolescents because by nature they are the group among the population who are at high risk of injury. They are inexperienced drivers and motorcyclists, but being so eager to be behind the steering wheel or riding a motorbike. Adolescents can be distracted easily. The problem will be more profound when they drive with their peers, as evidenced by the videos. I mean, everything will be heightened. They think it is fun to be together with their buddies, right? And they perceive something that actually dangerous to them as fun. They sometimes sneak out at night time to go for party or involved in something illegal. They think it is something cool. They could put themselves into risky situation by not being able to consciously perceive the actual danger that they are facing. Improper use of seatbelt, improper use of helmet, reckless driving style or riding attitude, or being under the influence of drug and alcohol are some other biggest challenges.
Alright, thank you, Dr. Fernandez. I think those mentioned by you are not only the problem in America but in other regions as well, right? Okay, so the next one I would like.
I just want to know if you're having any problem. Actually, lately I'm not feeling well. That's why I sleep. Well, you used to be an excellent student, but your grade has dropped. What's wrong with you? There's so many things happen lately, and I have to think about lots of things. So, and I feel tired. Are you sick? Did you go and see a doctor? I'm not sick, I'm okay. Yeah, I'm okay. Are you having problem with your family? Does your mother know about it? Why are you suddenly mentioning about my family? Why are you talking about my mom? She's so busy with her work, she doesn't even pay attention to me, she doesn't even care about me, so why should I bother her about this, right? Well, you know, right? You can always talk to me if you have any problem. I'm your teacher. You can always share with me. I don't feel like talking. Can I go now? Wait, Adia. We have to talk about this. The thing is that why do you care so much? Who are you anyway? My own mother doesn't even care about me. And who are you? Yeah, you're 16 years old and you're still young. You can share your problem with me. I just
How about the macro level?
Okay, so at the system level, the focus should be on making the environment safer with passive measures rather than just relying on education and adult supervision. So the first thing is pertaining to policies and infrastructure. So the government should make walking and cycling a healthy transportation mode and reducing the reliance on private cars. And road designs should also be improved with child-friendly infrastructure, safer routes to school, play areas, and also pedestrian areas. With regards to legislation and enforcement, three things could be done. So, speed limit should be observed, and also traffic should be regulated. The second one pertains to the enforcement of child restraints, helmets, and seat belts. And to control for alcohol, first, high visibility random breath testing should be enforced. The police should have jurisdiction to test for this without due cause, and the sale of alcohol to young people should also be controlled. As for the low-income group, to assist them in purchasing child restraints and helmets, the government should maybe provide a loan scheme or subsidization scheme to assist this group of people. And a program at the system level that we can try to implement is a program called Graduated Driving License. It's basically a program that allows young drivers to safely acquire experience before obtaining their full driving privileges. And this has actually been proven to be effective by a systematic review by Porsche and colleagues in 2014.
Alright, thank you, Prof. I think this is a good one. Graduated driving license. This is a proven systematic review, right? So I guess some other member state can actually take this, and then but customize to the condition in your country and implement it appropriately. Alright, and then the last question for road injury, I think I'll direct it to Dr. Fernandez Torres. Do you think what is the future direction of this intervention?
I believe the future direction that we are looking still is empowerment, right? We need to do more empowerment to the community, right? The effort in the region of the Americas will be multi-pronged and transdisciplinary, right? The way how we should approach or to conduct the empowerment were designed from various levels, right? This is by creating the atmosphere of awareness of seriousness of the issue, so that our community, aware and notice that this issue is something alarming. Education ideally should begin during the primary education, and also parents should play a vital role at home.
I think to have a healthy adolescent is pretty important. They are our future. Okay, so first of all, I would like to invite Dr. Ram Parata from South Asia to share with us the challenges and the intervention that we can do for an adolescent underway.
Thank you, Mr. Chairman. So firstly, the major nutritional problems which are of public health importance in my region, being the Southeast Asian region, of course, mentioned earlier, what I want to highlight is on undernutrition and its effect on the community. So first will be low birth weight, protein energy malnutrition, chronic energy deficiency in adults, and also deficiency of vitamin A and also iron deficiency. If you look at the prevalence of iron deficiency, it's worse in children under 5 years of age in this region. However, it's important to always remember that these children under 5 years of age will eventually grow up to be adolescents one day, and they will be predisposed to being undernourished adolescents once they've grown up. Secondly, I would like to move into the challenges that is faced mainly in my region. I have actually sectorized, I have actually put them into 4 major sectors, these challenges. The first being socio-economical, socio-cultural, at school levels, and also at the national level. So first, I will go into the challenges that is faced from the socio-economical sectors. The most important, I think, as highlighted by other regions as well, in the lower income and middle
Hello.